This is Bella Dawson 2.1 Initial Responses of Body Systems to Exercise. First, the respiratory dynamic. Dynamics is how the dynamics of the respiratory system move. When the respiratory system is in operation, there is a equation which shows how it works. This is VE equals BR times TV. This means ventilation equals breathing rate times tidal volume. Tidal volume is the normal volume of air you breathe in and out at rest. Breathing rate is the amount of breaths you take in per minute. And ventilation is the two put together, so the amount of air in the lungs, the harder you work, the more they increase, which increases the ventilation. At rest, this would be 6.5 litres. In pre-exercise, this would be 34.5 litres. And during exercise, this would be 147.2 litres. That is an overview of the respiratory dynamics within the body and how the VE equals BR times TV is used. Forced breathing and mechanics control. This is to do with how your muscles create movement when the volume and the pressure increases or decreases because of airflow. When exercising, inspiration and expiration is more forced as more oxygen needs to be circulated around the body. When inspiration happens during exercise, the external intercostal muscles and the diaphragm contract to move the rib cage up and out. When this happens, the diaphragm is pushed downwards. Because the inspiration is more forceful and more air needs to go into the lungs, the accessory muscles have to help to further move the thoracic cavity so that more oxygen is breathed into the lungs and there is a wider expansion. A higher volume of air needs to go into the lungs. Because more amount of oxygen is coming into the lungs, it's coming in at a higher amount and so much more faster. When this happens, the stretch receptors are triggered. This is when the Herring-Brewer reflex happens. This happens when just outside of the respiratory center in the brain, these stretch receptors are found in the smooth muscle of the lungs within the bronchi and the bronchioles to respond to the inflation of lungs. This reflex is decided by the vagus nerve, which sends an impulse to the medulla oblongata to control the inspiration. This is a protective reflex so that the lungs only expand to a capacity that they can, and so they don't get injured or punctured. The control of breathing comes from the medulla oblongata as it contains the dorsal respiratory group and also controls the ventral respiratory group. The dorsal respiratory group is a control group that makes sure the maintenance of breathing is a consistent rhythm. It does this by stimulating the diaphragm and the intercostal muscles to contract. This is what happens to the inspiration. However, when exercise occurs and more intense breathing happens, the ventral respiratory group stimulates the accessory muscles involved in forced breathing to contract and allow this to happen. As a result, in the volume increasing in the lungs, the pressure is extremely low in the air. Low in comparison to the atmospheric air pressure because air moves from high to low. The air moves inwards and that's why inhalation occurs. However, on the other hand, with exhaling, the external intercostal muscles relax and so pulls the rib cage back down and in, pulling the rib cage and thoracic cavity. Pulling the rib cage and the thoracic cavity is greater, and so the accessories muscles now force them inwards. This is an active movement compared to the diaphragm and intercostal muscles, which is a passive movement, and bring the thoracic cavity back in. At this point, there is no triggering from the vagus nerve in the stretch receptors as air is moving out of the lungs, and so there is no chance of too much air being in the lungs and damaging them, so the protective reflex doesn't have to happen. The dorsal respiratory group, which is in control of the rhythmic breathing due to telling the diaphragm and intercostal muscle to contract. The dorsal respiratory group stops, and so the impulse isn't sent. This no longer stimulates the diaphragm and intercostal muscles to contract, and now they relax, resulting in expiration. The ventral respiratory group then stimulates the accessory muscles involved in forced expiration and send an impulse from them to contract and further move in and down. As a result of the volume decreasing in the lungs, the pressure is extremely high in comparison to atmospheric air. Because pressure moves from high to low, the air movement is outwards, and that's why exhaling occurs. Next is the Valsalva maneuver. This is the action of attempting to exhale within the nostrils and mouth or the glottis closed. This increases the pressure in the middle ear and the chest as when bracing to lift heavy objects, and is used as a means of equalizing pressure in the ears. It increases the parasympathetic activity to the heart. Down pressure happens when the glottis closes. This means that the air pressure in the lungs increases and exerts force against the interior surface of the vertebrae column. The abdominal muscles contract, the erector muscles contract, the fluid pressure in the abdomen increases and exerts force against the anterior surface of the vertical column. During resistance training and core exercising, there can be benefits from using the Valsalva maneuver. Some activities in which you may use it might be a squat, deadlift, bench press, or push-up. It helps in improving the effectiveness of your activity. It allows you to lift heavier weights. It can also stabilize your core and back during a range of exercises. Having a strong and stable core means you are less likely to injure yourself during training. However, this technique can cause changes in heart rate and blood pressure. These can negatively affect some people that have high blood pressure. It temporarily limits the blood supply to the brain, and so can cause you to feel dizzy. It can also be used as a form of protection. For example, a sporting activity of this may be in boxing. When you know you are going to get punched in the gut or in the abdomen, your abdominal muscles automatically contract, which means that the force that is exerted onto your muscles contracting in the abdominal area can stop pain from occurring or reduce the amount of pain that will occur. Sorry about that last bit. It can also generate force, absorb force, equalize pressure, and trunk stabilization, which is within the spine. In my investigation data, we found the breathing rate of someone at rest doing moderate exercise and someone doing maximal exercise within the multi-stage fitness test. We assume their tidal volume from normal averages to work out their ventilation. Their ventilation was 6.5 during rest. In moderate exercise, it was 34.5, and in maximal exercise, it was 147.2. Compared to normative data, whilst resting, ventilation is 5 to 8 litres, meaning this person is average. During moderate exercise, it is between 40 and 60 litres per minute, which means they are under the average. Maximal exercise, the average is between 120 and 140, meaning they are over the ventilation average. That was during the multi-stage fitness test. Now moving on to the Wingate. We worked out his resting, which in ventilation was 6.5. This was within average, as average is between 5 and 8 litres. During moderate exercise, we worked out that he was 37.5 litres. This is just under average, as average is between 40 and 60 litres. During maximal exercise, we worked out that he was 150.2 litres. This shows that he is under average, as average is between 120 and 140 litres. In football, the Valsalva manoeuvre may occur if they are going to do a chest touch. They may think that it's coming towards their stomach, or they may tense up anyway, just in case it did go towards their stomach and they wouldn't want to get winded. They would tense up so that it hits straight onto their chest, but that would only last for about 2 seconds. After sprinting for the ball, they would use forced breathing, as they would be out of breath. They would be heavily breathing, which means that the muscle movement would be extra using the accessory muscles. The volume and the pressure in the air in the lungs would be very vast and very big. The airflow would be a lot, as a lot of oxygen would be needing to go to the working muscles. When exercising in football, their ventilation would be an average of 130. This is a high ventilation as they are doing a high activity sport. They will be breathing a lot and their tidal volume will be high, and so will their breathing rate, meaning that their ventilation would be high.